welcome back to KXAN Live. Thanks for joining us. I'm your anchor, Esmeralda Zamora, and today we have our Simple Health segment with Jose Torres. Jose, how are you doing today?
Yeah, I'm doing great, Esme. How are you?
I'm doing great. I wanted to start off today's show just touching a little bit about Simple Health and what Simple Health is for us here at KXAN. Can you kind of give us a little intro as to what Simple Health really is?
It's a way to tackle a lot of health issues and maybe treatments, research, and simplify it. And it doesn't have to be overwhelming. Also, some of these um, diseases or illnesses that people go through, or health journeys. There could be a simple solution to that, and that's our goal, just to bring that to viewers.
Yeah, like kind of breaking down these topics and making them simple, simplifying them for everyone to understand. I know that today, specifically, we are talking about strokes. Why is this a topic that you're interested in talking about?
In March of 2000, I suffered a stroke for the first time, and yeah, so it really opened up my eyes about my health. It lit this flame to, eat better, exercise, on a regular basis, and just take care of my body. Because prior to this, I wasn't as careful about what I was eating, what I was doing, and it just, I felt this sluggishness. I tell this story about how I used to eat a double cheeseburger with 20-piece chicken nuggets, a large fry, a large Coke, and that was just in one sitting. And I would do that a lot during my younger years. And anyway, yeah, all of that bad eating ended up to resulting in having diabetes, and then eventually I had a stroke in my early 40s. But now I'm doing much better, and like to just that's why it's a passion of mine to talk about staying fit and eating healthy.
Yeah, and it's people like you that have the knowledge behind all of this and what you need to know when it comes to suffering from strokes or, like you mentioned, diabetes. Giving your knowledge to our viewers is very, very helpful, especially people who may relate to you and are going through similar situations. And the American Heart Association and the American Stroke Association came out with some new guidelines that we're going to talk about today. What can you tell us about those?
Yeah, so these are guidelines that both associations came up with to help reduce the risk of for people to have their first stroke. That sounds kind of weird, but to prevent people from having a stroke in the first place. So both the American Heart Association and the American Stroke Association, they are urging healthcare professionals to screen their patients for sedentary behavior, which they say is a confirmed risk factor for stroke. They also want doctors to encourage their patients to exercise. And both groups say that Mediterranean diet has also shown to reduce the risk of reducing the risk for a stroke. Both associations are also calling for public awareness. They want really a huge campaign. And you might think like, I already know this, but they feel like there isn't enough about telling people about the benefits of quitting smoking, the benefits about increasing exercise, eating better, focusing on sleep, lifestyle changes that can really help reduce from having a stroke in the first place.
And every year, more than 500,000 people in the US suffer a stroke for the first time. And you spoke with someone who specifically suffered a stroke for the first time and is local to Round Rock, right?
Yes, her name is Alex Wilson Garza. At the time, she was 24 years old, and she's a nurse, a registered nurse at the ER over at St. David's Medical Center. St. David's Round Rock Medical Center. So 2 years ago, her boyfriend at the time, he's now her husband, he noticed something unusual, and here's how she describes it.
Whenever, you're suspecting a stroke, time is of the essence. I was with my husband. We were on the couch getting ready to go to one of our Brazilian Jiu-Jitsu classes when I wasn't starting to feel too well. And kind of from there is when I don't actually remember what happened.
So Garza, her husband, took Garza to her job where she works. So it just the roles reversed. You know, she's usually used to taking care of patients. Now she's the patient.
She's in that hospital bed now.
Yeah, and the person you see there with her, that's her colleague, Dr. Trent Rublo. He's a neurologist at the ER, and he treated her when she came in. And after some testing, they found out that there was a blood clot in her brain. And Garza said she was really surprised, you know, that this happened to her. She lives an active lifestyle. She eats healthy, and excuse me. But the doctor that we talked to, who also treated her, says there can be other risk factors.
And we have a sound from him as well, right?
Women of Alex's cohort, a significant risk factors, things like oral contraceptives, things that people don't generally think can cause blood clots to develop, but this is actually a risk factor for stroke.
Now, we do have some more insight on what the American Heart Association or the recent guidelines that came out. And that first screen that we have, screen grab, is stroke warning signs. What can you tell me about these 4 things that we see on our screen?
Yeah, so the American Heart Association and the American Stroke Association, they use this abbreviation called FAST to describe the symptoms. Face drooping, you know, if maybe you're noticing a loved one that one side of their face is drooping, or maybe they're telling you that it feels numb. So you ask the person to smile, and if the person is having trouble smiling, or maybe that person's smile is uneven, that is, you know, a sign of face drooping. Arm weakness is another one, when one arm or goes weak or goes numb. So if you're in that situation where you're noticing that, you could ask that person to raise both arms, and does one arm drift downward compared to the other? The other thing is speech difficulty, and if they're having trouble speaking, their speech is slurred. And T is for, well, that's the time to call 911 because every second counts. And so the faster you act, the better chances you are of preventing any debilitating results. The other symptoms to watch for are numbness or weakness of the face, arm, or the leg, especially if it's on one side of the body. Confusion, trouble speaking, or understanding speech is another. Trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination. Severe headache that just comes out of nowhere, that is also a sign to watch for.
Wow, and all of these symptoms are different for everyone. Not everybody receives or gets all of these symptoms in one, right?
Right. In my particular case, I was just sleeping, and my left arm was over my left side of the face, so I was sleeping like this. And I was having trouble. I woke up and I'm like, wow, why is there a brick on my face? So then I was trying to lift my left arm, and it just felt super heavy. And I still was like not fully conscious. You know, I just woken up. And but then those symptoms went away. And but then they came back a few minutes later, and then I started to freak out a little bit. I thought, okay, gosh, am I having a heart attack? So I Googled symptoms really quick. And but then my symptoms went away again. So I called 911 and I asked, you know, for EMS to come to my house and take me to the hospital, because I thought that's what I needed to do. And as I was speaking to the 911 call taker, I noticed that my speech was slurring. And I told that to the call taker, and by that time, the paramedics came to my house, so they got here to my house pretty quickly. So this was at the start of COVID in March of 2000. And by the time the medics came to my house, all the symptoms went away. I wasn't feeling anything. They evaluated me, and because it was the start of COVID and everyone was sick, they told me just to, stay home, and then the next day, just book your appointments with your primary care physician, and then go on from there, which I did. And yeah, so short answer, yes. You don't experience all of these symptoms at once, but those are signs to watch for.
And that's amazing that you knew exactly what to do in that moment and you had the knowledge to think maybe this is happening to me. I should call 911. And this is why these guidelines are out there so that everyone can refresh their memory, so everyone can get educated on what they need to do to look out for these warning signs, right?
Yeah, and you would think like, oh, doctors should encourage this in the first place, but there more than 50 million people a year have a stroke for the very first time. And so the goal here is to get everybody to recognize the signs or recognize the simple things that they can do at home, like exercising and eating well, sleeping. Sleeping plays a big factor because if you don't get enough sleep, then, your hormones are a little off. You're going to eat a little bit more. You're going to want to lean towards eating, like the junk food rather than, the whole natural foods that you can cook at home.
Yeah, and it can happen to everyone, or anyone. She is a nurse, and she ended up right back in that ER room, and this time as a patient. And she probably didn't know or didn't think that this could happen to her, especially when you already are on a healthy diet or you feel like you work out consistently. This can happen to anyone if you're not taking care of yourselves, right?
Exactly, and her case is really rare. Also, the doctor that I spoke with that also works at the ER, as you heard from his the little snippet of that interview, there are other risk factors like oral contraceptives that could increase the risk for stroke for women. So yeah, there's a lot of things, to look out for.
And we do have your article published on our website, kxan.com already. You can find it on the homepage, easy to find. And it's titled From Emergency Nurse to Patient, 24-year-old Lives Through Stroke. And what can you tell us that is also in this article that we didn't get a touch on?
What I found a little bit fascinating is why time matters when you're suffering a stroke or where you're noticing someone who is showing those symptoms. The doctor told me that approximately 1 million brain cells die per minute in a serious stroke, and it's irreversible, so you don't get to generate new brain cells, he says. So the longer the stroke is allowed to happen, the more the brain will die, so the more likelihood that that those symptoms will be irreversible. So when they say time is of the essence, they really mean that.
And after suffering a stroke, it's a journey to get back to where you were before you suffered that stroke. So being on top of it, being proactive, is probably the best thing we can do as individuals, right?
And for Alex, who is so active, she does
kickboxing or jiu-jitsu.
Yes.
I think I saw that.
Her and her family, they go out for walks. They live an active lifestyle. So when this happened to her, the hardest part was the recovery. She was able to go to work like 2 to 3 weeks after the stroke, but getting back to an active lifestyle, that it took her, I believe she said 3 or 4 months. So you'll read about that in this web story about her recovery.
Yes. Well, thank you so much for joining us, Jose. Always a great topic with you, and we can't wait to find out what topic we will be covering next week. Thanks for joining us.
Yeah, thank you, Esme.